If you're dealing with stubborn melasma that won't budge or hair loss that just keeps getting worse, you have probably reached the limit of what a standard drugstore cream can do. Healers Pharma operates as a compounding pharmacy, focusing on pharmacist-prepared dispensing medicines instead of mass-market cosmetics designed to sit safely on retail shelves. Compounding dermatology produces highly concentrated active ingredients. These are the targeted formulas a dermatologist reaches for when an off-the-shelf product isn't enough. You might be considering upgrading to these high-strength actives to finally see some movement on your skin or hair concerns. But stepping up to this level comes with an inescapable trade-off. Targeted clinical precision requires strict medical responsibility. Know exactly how to use them, keep your expectations realistic, and have professional oversight. This comparison matrix lays it out clearly. On the left, standard retail cosmetics are low risk and meant for general use. On the right, compounding dermatology offers targeted precision and high strength, which is exactly why it requires professional oversight. Exploring Healers Pharma is about mapping out your clinical options so you are fully informed before you sit down for a mandatory consultation with your dermatologist. Let's look at the most common clinical concern we see in Pakistan: severe hair fall and pattern hair loss. Healers Pharma's core hair protocol relies on compounding 5% minoxidil with 0.1 or 0.25% topical finasteride solutions. This flowchart maps the clinical workflow. Starting with the minoxidil and finasteride blend, the path splits. The outcome side increases blood flow and targets hormonal drivers of thinning. But the red trade-off branch shows these regulated medicines demand strict individual clinical vetting. We must discuss contraindications for topical finasteride because they are severe. These solutions are absolutely disqualified for anyone who is pregnant or planning pregnancy. Furthermore, if your hair loss is diffuse or driven by conditions like PCOS, you need completely different diagnostics to find the root cause before attempting to use these heavy-duty sprays. Applying powerful hormonal treatments without a targeted medical diagnosis is not only useless for your hair, but potentially harmful to your overall health. The second major clinical pillar of the brand addresses fading stubborn pigmentation, melasma, and post-acne marks, which are extremely common across Pakistani skin tones. To tackle this, Healers Pharma formulates with high-strength tyrosinase inhibitors, specifically 5% tranexamic acid, glutathione, and 10% L-ascorbic acid. This flowchart charts the workflow for treating pigmentation with high-concentration brighteners. The outcome path shows tranexamic acid fading targeted marks, but this takes weeks of patience. The trade-off: incorrectly using these potent actives inflames the skin barrier, potentially triggering even worse pigmentation. Because these actives leave skin vulnerable, treating pigmentation mandates aggressive daily defense. A product like Sun Care 60 SPF becomes a mandatory companion to any brightening routine. Sun protection is the only variable that actually protects and locks in the clinical results you are trying to achieve with those serums. Investing your time and money into clinical-grade melasma treatments is completely negated if you fail to commit to rigid daily sun protection. Beyond brighteners, we have to look at the unglamorous but essential foundation of clinical dermatology: repairing severely compromised, thick, or cracked skin barriers. For this, the brand utilizes a heavy-duty keratolytic agent, their 40% urea cream. This diagram illustrates the extreme effects of high-concentration urea on the skin. At 40% concentration, it acts as a keratolytic, aggressively breaking down rough, callous tissue. Without exact professional guidance on where and how often to apply it, misusing keratolytic agents can result in severe chemical burns and total barrier collapse. Using these clinical formulations provides a potent toolset stripped of the safety bumpers found in standard retail skincare. The efficacy of these dispensing medicines scales directly with your personal discipline and your strict adherence to medical guidance. To see exactly who should and shouldn't use this brand, look at this quadrant chart. We are measuring the severity of your concern against your willingness to follow strict protocols. Healers Pharma is isolated solely in the top right quadrant. The ideal candidate residing in this top right quadrant is the stubborn sufferer. This is someone dealing with diagnosed clinical issues like pattern hair loss or severe resistant melasma. Crucially, this ideal user must be willing to introduce actives slowly, consult professionals, and maintain strict protective routines like daily sunscreen.
If you fall into the lower or left quadrants, you must avoid these formulas. This includes the casual sampler looking for a quick glow-up, or anyone unwilling to commit to daily SPF. Ultimately, utilizing high-percentage compounding formulations is a clinical decision. Use this breakdown as a baseline to have a highly productive, specific conversation with your dermatologist about what your skin actually needs.